Come on, baby. Have you ever heard of a cluster headache?
No. No.
No.
This is my mum's office, where she comes to work when she has her good days and is actually able to leave the bed. Her work has been more than a massive help to her, as they have constantly provided her with paid sick days, supplying a few extra office supplies since my mum often has sick days. I decided to interview her to get the best possible outlook on a real CH sufferer. So, I'm here in my mum's office on one of her well days, here to interview her, ask her a few little questions. So, question 1. What happened when you had your first cluster attack? Did you know what was happening?
No, to be honest, I had no idea what was happening. In fact, I would say that we actually thought, to begin with, it might be a really, really bad ear infection or a sinusitis infection, but it was all on one side of my head, and that went on day after day, and it would last for, say, 3 hours, and then it would go again, and then it would come back. So we really didn't know what it was, but the pain was so bad that we ended up thinking it was probably some form of tumour, cancer in my head, and it was something that I was going to die of, because the pain was so bad and the attacks just kept coming, and it took 8 weeks before we got diagnosed properly, before we got through 7 doctors, numerous people, consultants at A&E as well.
Did you need to go to a specialist then?
Yeah, eventually, in the end, we went to see a neurologist who we've had found out specialised in cluster headaches. And the reason that we went to see her, we had to pay a lot of money to go and to get the diagnosis. But we went because there are certain symptoms with CH, like a low droopy eye. You will see some of the photographs of me within this documentary, and sometimes a very blocked nose on one side, a very runny nose on the other. The pain is just beyond anything I could describe. So yes, we went to a specialist. We Googled a lot, and we thought maybe this cluster headaches is what I've got. So we went to a neurologist who confirmed that and actually gave me a firm diagnosis.
Do you feel that your doctor has been supportive and fully understands the disease and what you're going through?
My doctor, luckily, unlike many people who suffer CH, they don't have as much luck as I think I have. My doctor is very, very supportive. He's found out as much as he possibly can about CH, cluster attacks. He's made sure that all the other doctors in the practice can spot the symptoms of cluster headaches as well. He hasn't been brilliant with the medication that I need. That's really been routed through the neurologist.
Describe in your own words what a cluster attack feels like.
Okay, so in my own words, And one of the ways that I got diagnosed was using photographs to show the neurologist, because you don't often see a cluster headache having an attack, because they tend to be in the early hours of the morning, or people tend to hide themselves away from family and friends. But basically, for me, it feels like there is a massive screwdriver literally being shoved right down my ear hole. I feel that I have maybe like hooks or ice picks, or sometimes like tattoo needles in my eyes, in one side of my head only. I also can feel like I've had scalding hot water poured over my head, and that attack can last from anything from 15 minutes to 3 hours. My longest was 4 hours, where I ended up in A&E. It is indescribable, worse than giving birth, which I have done. They say worse than having an operation without anaesthetic. I have done a self-portrait here where I show myself how I feel when I'm having a cluster headache, and a self-portrait of how I feel in a cage when I'm having a cluster headache as well.
So, how often do you have the attacks?
Unfortunately for me, because I'm a chronic, you have two types of cluster headaches. You have episodic cluster headaches, which usually come at the same time of the year, fall or spring or October time, and they'll last for 3 months of the year. Then they'll go away. You can have up to 8 attacks a day. Unfortunately, if you're chronic, which I have been now since October 2016, I can have attacks every single day, up to 8 attacks a day. I am on medication, which does reduce the attacks, but I'll just show you here, from May to December, my sick record for work is massive. I'm very lucky with work, and I'm sure we'll come on to that in a minute, but yeah.
So what do you feel like after an attack?
After an attack, I feel absolutely exhausted. I often don't even go downstairs. I mean, I've probably spent 3 weeks just recently upstairs in my bedroom, unable to cook or to do general normal things in life, because I am absolutely exhausted from being so ill all the time. We also suffer something which we call shadow headaches, and it's part of having cluster headaches, where it kind of feels like you've got a small screwdriver stuck into the corner of your eye or something, and it just hangs around there all day. And just normal everyday life is difficult to cope with and to deal with. Also, my memory loss is a big part of CH, and I really have lost lots of my memory as well, so it affects my whole life in a bad way, really.
So what medication do you take or use to abort a cluster attack?
The first thing that I go to at all times is my 100% oxygen, which we use at 15 litres per minute. Normally for about 20 to 30 minutes if you've got a mask, but if you have a demand valve like this, it's super better. So if I get straight onto this, and I'll give you a quick demonstration. That's directly from a can of oxygen. If I use that, sometimes it will abort the attack completely. Also, Red Bull, we don't know why, the neurologists don't know why, but Red Bull, the combination of taurine and caffeine together and oxygen can abort attacks as well, really well. But obviously Red Bull isn't very good for you, so it isn't really promoted. So oxygen's my number one. That gives me no side effects, it's great. If I'm suffering from the shadow headaches, which I talked about earlier, where you feel like maybe you've got like a smaller screwdriver or hook stuck in your head, maybe just a small firework, then I will use Sumatrapan tablets, which take a long time to work, but they do take the edge off of a shadow headache. However, if my cluster attack reaches above KIP level 7 on the KIP pain chart, which will be in the documentary, I will use an injection, which I'll show you. It's just like an EpiPen, basically.
I'm going to take an injection now, and this is going to hopefully make me feel better, but it bloody hurts. 1, 2, 3. Ah. That's done. Hopefully I'll start to feel better, but the side effects are mega bad. So
I put it in my leg, I click the button, and the medication, which is called sumatriptan, goes into my body, and within 10 minutes I can start feeling the effect of it working in my brain. Literally, I can feel it in my nose, in my eye, in my head, all on that one side. The after effects for me, although they get rid of the attacks, if I have too many injections, I do get chest pain, and I've damaged my intercostal muscles in my chest. So I try to use them as little as often, but they really do work. They are a lifesaver. So that's the main medication that I use in the daytime to abort the attacks. But I'm also on lithium, which is a hardcore drug, and again, it doesn't really give me any side effects, but all it does is helps to suppress the attacks a little. So rather than 8 attacks a day, I will in general have 1 to 2 attacks per day.
Have cluster attacks affected your work life?
Yes, very much so. Most people with chronic CH either end up losing their jobs completely, because we just can't be there, as my sickness chart shows you. We just can't be at work all the time. I'm very, very lucky that I work for a company that are just amazing, and I get on personally very, very well with. And what they did for me is they actually set up this office at home for me, paid for everything in it, and we basically have an agreement that if I'm well, like today, then I will work, and if I'm not well, I'm not well and I don't work. And that has been sustainable for 2 years now. They're absolutely amazing. I couldn't ask for anything more from my company, but that is not the case for a lot of people out there with chronic CH. And I have to say that because most people, either they lose their jobs, or if they possibly can, set their own businesses up. But it's very, very difficult, as it's so unpredictable when you're chronic how ill you're going to be, but a lot, so it is very hard to work.
How have cluster attacks affected your home and social life?
Well, I'll deal with social life first, because home is a bit more painful, but social life equally painful in a way. I've always been a very, very sociable person, and now I would say I'm pretty much agoraphobic. I don't want to go to Tesco's. I can't drive my car as much as I used to. I'm scared of driving anywhere in case I have an attack. I'm scared of having an attack out in a social environment, like the pub, or, you know, or around my friends, because lots of my friends have got small children. I'm absolutely petrified of having an attack out, how I'm going to get home, those kind of things. Depression and anxiety have led me not to be able to go out due to this illness, without a doubt. Home life, very difficult, because basically all I do is, if I'm well, I work, and if I'm ill, I'm ill. And if I'm ill, then it's either my husband Paul, who happens to be a London firefighter, so he's not here a lot. He's 2 days on, 2 days 4 days on, 4 days off. 2 of those are nights. So most days he doesn't get home till 9 o'clock, and then there's 2 nights every week where he's not here at all, which leaves my son Torin, who is the only family member that lives in this area. We haven't got any family here at all, and that leaves Torin being really my primary carer. Torin does everything for me when I'm unable to help myself due to attacks.
Have you experienced any PTSD? So like post-traumatic stress or any other stress or anxiety related to this issues before?
Yeah, the worst one that I have got, which has been diagnosed as PTSD, is it's almost like you know, the people get sleep apnea and they go to sleep and then they stop breathing. It's very, very similar to that, but instead, just as I'm about to fall asleep, I completely stop breathing. I feel like I'm drowning in the sea and I'm clawing and fighting my way to breathe and get out of it. And I do get out of it, but that can happen 2 or 3 times, even up to 6 times in a night, because I am absolutely petrified of going to sleep because of my attacks are always between 3 a.m. in the morning. So anytime from 3 a.m. to 5 a.m. in the morning, that's when my attacks will start. So I know when I lay down to go to sleep, I'm going to wake up in what the medical world say is the most painful syndrome in medical history. So I know every morning that I'm going to wake up with that, and yes, I do suffer massive anxiety, stress and PTSD to the point where I stop breathing.
Are you able to get any benefits such as disability allowance or any disabled parking? I imagine it's quite scary going to shops if you're unable to park nearby.
Exactly that. Whenever you go out, I mean, we do have small packs of oxygen that we can put on our back, but trust me, they're heavy, especially when you're exhausted. And no, I know one person who has chronic CH who has managed to badger their council into giving them a disability parking badge. Disability badge. That's it. Out of all of the people that I know all over the world with this awful disease, which is what it is, and in this country there's a benefit called PIP, PIP, and it is so difficult to qualify for it. Most people with CH go through terrible battles to even get the smallest amount of money. Every 6 months it's reviewed by people that are not doctors, by people who are not neurologists. These are people that work on councils. They go into a CH person's house and they may go in on a day like today where I look well, and they'll say, oh well, how great you look, how great everything is, when actually 3 weeks before that you're crawling to the bathroom. Yeah, so a lot of people that apply for PIP don't get it. They have to keep reapplying for it, and to be honest with you, I am so exhausted from my illness that I have actually not applied for it because of all of the horror stories that I have heard from all of my friends in my help groups for cluster headaches. So no, not really. And when it is available, it's not good, it's not enough money, and it doesn't help people.
Have people ever commented stating how well you look on your good days? How did this make you feel?
It's just what we was talking about. It really used to annoy me a lot. I've really learnt to deal with people by just holding up an imaginary mirror to people's comments and opinions, okay? They don't know that I've probably spent 2.5, 3 hours trying to make myself look okay enough to come downstairs. They do say it, and I generally just make a jokey comment now about, you know, I buy 2 shades darker face lotion to look better. Face, whatever you call it, I can't remember the word because of CH, but yeah, it is annoying because people do judge you, but I've learnt just to let other people's opinions go over my head, really.
How long did it take for you to accept that CH is incurable, knowing unless they find a cure, that for the rest of your life you will suffer this infliction?
It took about 2 years. It took a month away from family and friends, where I basically went away and had a bit of refuge, where I stopped getting excited that I'd had maybe a week pain-free. I stopped getting excited thinking maybe it's going to go, and I just realised if I just try to accept it and get through it as best I can and try to enjoy the times like today when I have a pain-free day, and that's what I'm doing at the moment. And one of the ways that I've done that is I never thought I could, but I paint and I play some musical instruments now that I never did before. As you can see in my office, my work office, I have now put up the majority of the paintings that I've done since I've had CH, and I also write poetry to get my feelings out. So that's how I've coped with it, but I've had to learn to accept it, and it's taken a long time, and still now I just want it to go.
Do you still have hope that one day they will find a cure?
I have to have hope. I have to have hope to keep going. So, yes, if hopefully it's in my lifetime, who knows. I know people personally myself that have suffered with this now for 25 years plus. But I really do hope. I do.
This disease is also known as the suicide headache throughout the medical profession and cluster community. This is a very difficult question, but have you ever had any feelings that reside with this saying? Be honest.
Obviously a very difficult question to answer to your son in an interview. But you know that I have. I have times where I just can't see how my head can possibly take any more pain than it's taking, so I kind of think I'm just going to die anyway. Then I'm wishing that I would die. I've had many suicidal thoughts, many. I've even looked up euthanasia and if you can get it done for cluster headaches. I've thought of all the different ways that I could do it, but what stops me and will always stop me, and I know I will never do anything silly, is because I will never ever leave my son and my family with the legacy that I couldn't take the pain and bailed on them, because I see myself as a CH warrior, not a sufferer, and I will be here for my family.
Okay, brilliant, that was amazing. Thank you so much.
That's all right, thank you.
Do you want a tissue, Ray?
I'm all right, thank you.